Hi guys, welcome to RAAONLINE. This is Dr. Ashok. So today we are going to deal about one of the most commonest nematode infection in our Indian setup, and you all know, like whenever you are going to go to your clinical posting, we are going to see cases pertaining to the enlarged leg. So there's going to be a case of pedal edema. So there's going to be various pedal edema like pitting pedal edema and non-pitting pedal edema, and we have something called unilateral and bilateral. So today we are going to deal about one of the most commonest infection which is going to lead to this kind of pedal edema. So let us see about filariasis today. So what is a filariasis? So whenever we talk about an parasite, so we are going to classify them into protozoa and helminth. And again, example for protozoa is going to be the entamoeba, giardia, malaria. Those and all will come under the protozoa. And we have something called helminth. So whenever we talk about helminth, we have something called as a cestode, trematode and nematode. So those kind of Taeniasis and echinococcus, they comes under the cestode. And we have the trematode, various flukes like Paragonimus, Schistosoma, Hematobium, and Clonarchus, Apistarchus. So they come under the trematode. And we have the nematode. So under nematode, we have the blood nematode and the intestinal nematode and the tissue nematode. So this particular filaria comes under the tissue nematode. So it is one of the arthropod-borne parasitic infection. So it is transmitted by the bite of a particular mosquito called Culex. So when there is going to be Culex, there is going to be species. So here there is going to be something called Culex quinque fasciatus. Okay, this particular. So here the species is going to be quinque fasciatus. So here the particular organism is going to harbor the L3 filariform larvae, and when it's going to bite us, it's going to inject it, and the particular organism is going to cause infection. So let us see about it. So it is one of the arthropod-borne parasitic infection, and it's caused by a nematode called Wuchereria bancrofti, and it is transmitted by the insect vector, that is the mosquito belonging to the Culex, and species is going to be quinque fasciatus. So this particular infective vector is going to transmit the particular infection. So before going to the topic, I just want to tell about the particular mosquito. As a medico, you should be able to identify which mosquito is going to be Culex and which one is going to be the Aedes and which one is going to be the Anopheles. So when we are going to talk about Wuchereria bancrofti, it is essential as a medical students to identify what kind of mosquito are we seeing in our day-to-day life. So whenever you are going to see about Culex mosquito, how are we going to find it out? So there are few points that is going to aid us in finding out the mosquito type. So let us see one by one. So whenever there is going to be Culex, so there is going to be the proboscis on the body. So here the proboscis, so this is going to be the proboscis and this is going to be the body. So there is going to be a proboscis on the body and there is going to be angle. So proboscis and the body at an angle to one another. So that is the first point. And the second point, when we are going to talk about the wing is going to be an unspotted wing. So here there is not going to be any spot present in the wing. So it is going to be an unspotted wing. So this is identification number 2. And identification number 3, the body rests parallel to the surface. That is, so this is going to be the surface and the body is going to rest parallel to the surface. So here the body is going to rest parallel to the surface. It's going to be point number 3. And point number 4, it's going to be a blunt abdomen. So the abdomen, it's going to be a blunt abdomen. So this is going to be the point number 4. So these 4 points is going to favor the identification of the mosquito species as Culex.